Hey, welcome back. This is Pints and Pelvic Health. I'm Megan Kranenberg, Doctor of Physical Therapy, and I'm joined here today with
Josie Ball, Doctor of Chiropractic.
Cheers.
Cheers.
What are you drinking, by the way?
A little kombucha today.
Kombucha. All right. I have a Doppelbock. This
Ooh.
is, I know it's early in the morning, but you know, it's
Okay.
5 o'clock somewhere.
Right, absolutely.
All right. So, the issue that Josie and I probably overlap with the most, that we see a lot of, and it can be kind of a question of, hey, who should I go to for this? And sometimes it's, this is one of those things, kind of just depends on where you live and who's closest to you and
Exactly.
who do you connect with.
Absolutely.
And is the issue of pregnancy-related pelvic girdle pain and low back pain, which are two separate mechanisms going on, which we can talk about a little bit more. Josie, I would love to hear, you start up. Where's your understanding of pregnancy-related pain coming from?
So for me, biggest thing to watch, three things. Looking at the relaxin hormones that really change in the pelvis and how much movement's occurring. And there's so many changes in the woman's body going on.
Yeah.
And so really paying attention to the hormonal changes that are working in there. And then we look at the biomechanical pieces and seeing the structures. And I think one of the coolest pictures I saw recently is just the accommodation intestinally on the internal side of the body.
Oh, yeah.
Like when the uterus fills that abdominal cavity, and where do your intestines go? Where does your stomach go? Where does your bladder sit? And I always laugh, like, really, why did we get designed with the bladder underneath all of this? But I think that's just a mean joke.
I will link to some comments in the video of just some images of what Josie's talking about how, the expanding uterus starts to displace those internal organs. And, I think one of the tools in my toolkit as a PT that I don't know, there are definitely chiropractors that do this kind of work too, is really paying attention not just to the change that's occurring because your joints are looser, but if you have any kind of history of endometriosis, chronic constipation, irritable bowel syndrome, PCOS, if you've been someone who's been dealing with internal inflammatory processes for a while, and then and so maybe your internal organs are a little bit stuck to each other, and they don't really like to glide and slide and be slimy and get out of each other's way. Pregnancy can add kind of a double whammy to that, because now the uterus has to move, the baby needs to grow, but those stuck tissues will tell you they're not happy.
Yep.
I find that a lot with like round ligament pain and SI pain. The kind of the 4 different types of pain classification that I look at in pregnancy would be low back pain, right? That's common anyway.
Yep.
And if you were already a little predisposed to any of these before pregnancy,
your cup may runneth over.
you might, yeah. That is a really nice way to put that. Cheers. Maybe not in the nice way. But now you've got, I was talking viscera, right? Okay. If you're predisposed, like if you were already loosey-goosey in your pelvis before, maybe you could kind of hold it all together, but now your body's just going to point out the weak links in your chain.
Exactly.
So, yeah, there's a lot to do with the relaxin hormone that releases everything, and that can be the contributing factor for SI joint pain and pubic symphysis pain, low back pain. Neck and shoulder and
all the postural changes and breast tissue changes that are going on. I mean, there's just so many pieces to all of this.
50% more blood volume.
Right? I mean, we're just ultimately heavier.
So I always tell my patients, use like a triple, quadruple, maybe quintuple whammy on your body a little bit.
So much going on.
So just that extra load, right? So when it comes to kind of the relaxin hormone stability, what do you like to do? What are the tools in your toolkit?
The 2 big things I kind of like talking to women about is home care, things to do on their own, because they're not in to see me all the time.
Yeah.
Ultimately, my goal would be to see them once a week through pregnancy, just to make sure pelvic alignment and everything.
Yeah.
And there's starting to be some studies coming out that they're showing proper pelvic alignment is shortening birth durations and labor times and all
Yeah.
of this kind of stuff. But
Yeah.
we don't live in an ideal world, unfortunately.
We
Insurance
don't.
doesn't cover these things, and it's just,
Yeah.
we do the best we can with that stuff. So
Yeah.
my goal is to teach women how to take care of their backs most effectively.
Yeah.
And especially moms that already have small children at home and they're having to carry the other kids around, and how do we still find our core brace even in third trimester? How do we bend over most effectively and pick those other children up? How do you
Yeah.
load the dishwasher? How do you get in and out of your car? And just really educate patients on the best ways to take care of their spine, because ultimately I'm not the one that's taking care of them. I don't get to follow them around all day
Yeah.
long, kind of thing.
We are on the same page about that,
Absolutely.
for sure. I keep a whiteboard in my clinic. Like, it's pretty low tech. There's the
Absolutely.
whiteboard.
I'm
and-
constantly drawing pictures for
Exactly,
everybody.
yeah. Pictures, education, I think, is the key component.
Exactly.
Because we just know that it's not enough for someone to say, well, just don't lift it. You know, one of my hugest pet peeves in maternal care in America, and we're talking pregnancy right now, not
Absolutely.
postpartum. One of my hugest pet peeves is that women at the hospitals are told after cesarean delivery, well, don't lift anything heavier than your baby. Hi, if you have an older child at home that needs to be put in a car seat,
Yep.
you are going to be lifting things that are heavier than your baby.
Well, and how many people have a partner that is going to be home with
Yeah.
them through the entirety of that
The
healing
the
time?
pregnancy and postpartum.
Absolutely.
So learn, my prayer, my mission, my white light to the universe is that those conversations become not, don't do this, because then women get afraid.
Exactly.
And when women are people in general, this is not just a gender thing.
Yeah.
When people are instructed to be afraid of certain movements, they experience more pain and dysfunction with those movements, right?
Psychosomatic.
Right?
Yeah.
So any OB residents that are listening to this right now, or
Please.
primary care physicians, or labor and delivery nurses, let's change that conversation to lifting could be difficult. Lifting might compromise your scar. So please go see this trained chiropractor or this trained physical therapist, because they're going to show you the way to manage this most effectively, because
Absolutely.
you got stuff you have to do.
Let's empower these women to
Yeah.
know their bodies, to take care
Yeah.
of their bodies, and then to seek the professionals that are going to
Yeah.
help them in that process most effectively.
Yeah.
Absolutely.
Are you Webster certified?
Yep, Webster certified.
Tell me, what is the Webster method? Tell me more about that.
So the concept behind the Webster technique is
Okay.
assessing the pelvis for improper alignment and improper movement. And so we're looking to see that the pelvic bowl is most neutral. And
Okay.
that we're able to actually open most effectively. So if you think about that pelvic bowl being slightly twisted, if you end up with an anterior pelvic tilt on one side and a posterior pelvic tilt on the other, that opening and closing during labor is not going to happen as effectively, and that baby's going to have a harder time coming through that birth canal. And so if we get a proper alignment of that pelvis, that pelvic bowl is going to open and close more effectively. Baby's going to want to drop into the canal much more effectively. It's kind of the whole concept. Pretty simple stuff.
Yeah.
But
Are there
it's-
some articles we can link to in the
Absolutely,
comments
yeah.
that kind of go like what the outcomes have been after
Absolutely.
undergoing that
And they're
treatment?
really working on a lot of research on this
Yeah.
right now. Jeannie Ohm is a chiropractor on the East Coast.
Okay.
She teaches the Webster technique
Okay.
classes most effectively. The woman is brilliant. I think she has either helped to birth all of her children herself with her husband, and I think she's helped to birth all of her 20-something grandchildren.
Okay.
And this woman has been around birth and gets it.
Yeah.
And she studied as a chiropractor, so pelvic health is her passion.
Yeah.
And learning from her was probably one of the highlights in my career.
Oh,
really-
that's fantastic.
absolutely.
Because I think we have to be really careful, you know, as healthcare providers, especially sitting here creating content that we know is going to a wider audience. There are things that we do because it makes sense clinically and it makes sense physiologically for that person.
Exactly.
The evidence behind some of these treatment methods is poor
Yeah, it
because it hasn't been around for long. People are in the process of establishing high quality trials for this. And also in our world where we are hands on, we can't have a double-blinded, randomized, placebo-controlled trial about releasing someone's round ligaments in pregnancy, and did that help? Because there are so many other factors at play with the human body, and your hands are different than my hands, And so it's really hard to find that high quality objective data. Which means that you and I are both constantly like fighting with insurance companies, like, yes, this matters, right? And there's really, you and I are the tip of the iceberg in the chiropractic and physical therapy communities of the research that's being done out there right now. So, if you have more questions about that, there's blogs, there's great things. We can link to what we know in the comments. I would say that the counterbalance in the physical therapy world to Webster method, as far as looking at how can we optimize the pelvic alignment during pregnancy, not just for delivery outcomes, because sometimes it's just going to be what it's going to be. Your pelvis is a different shape, that baby's going to be breached. 10% of deliveries, according to the World Health Organization, really do need to be cesarean delivery, and aren't we lucky to have a safe approach for that, So I kind of look a lot at the viscera, not just the joints and the ligaments. Maybe it's laziness, I don't know. I've gone away from being too worried about so much of the upslips and the downslips and the nutation.
They're going to happen.
They're going to happen, and we move. It's dynamic. And I just kind of look a little bit more like, how much room do we have? And so I'm on bellies a lot, releasing the broad ligaments and the round ligaments because it feels good.
Absolutely.
That tends to really relieve pubic symphysis pain, especially.
Absolutely.
And then so much about coping with labor can just be learning your own self and learning how do you handle tough situations. Absolutely. And how can we translate that to
and helping a woman to connect to her
outcome.
body and know those sort of pieces and be like, okay, we're working into these, and you can build that brain connection with the physical aspects of what's going on, and that's empowering in itself.